Good morning. I'm Dr. GHAZWANI, and I'm glad to share with you our experience in one of the tertiary centers in Saudi Arabia, King Abdulaziz Medical City in Riyadh, about sacral neuromodulation. As we all know, sacral neuromodulation was a modality used for treatment of voiding dysfunction. It was introduced early 80s and get FDA approval on 90s, as well as 2010 was approved for fecal incontinence. Since that time, it was the treatment for refractory overactive bladder, as well as idiopathic urine retention from urology point of view. And it's differ from country to country how these procedure frequently done based on several conditions and based on acceptance of this treatment by the patient themselves, as well as awareness of other colleague from other specialty or from urology specialty also, to refer these cases for this complex and expensive treatment. At our center, this treatment was introduced in 2016, and we reviewed our data retrospectively over the last 4 years, and where we included 28 patients were candidate for this treatment. Female representing the majority, around 60% or 61%, while 39% were male patients, and the age was ranging from 17-year-old up to 71-year-old, with mean of around 38-year-old. The diagnoses were majority is idiopathic urine retention, which representing around 64% of the cases underwent this procedure, followed by urinary incontinence, which in total representing around 32%. Urgency, frequency, and only 4% of the cases. In our technique of doing sacral neuromodulation, it's a staged technique where both stage done under anesthesia in OR, considering our community and that difficulty to do peripheral nerve evaluation. So it is stage 1, and if the patient showed improvement in his symptoms or her symptoms by 50% or more, then he or she will be a candidate for permanent implantation. Among those patients who underwent this treatment, we're having around 50% of them still enjoying their treatment. With some of them, we had exchanged their IPG, while unfortunately we had some of them removed their sacral neuromodulation after permanent IPG was inserted, and this in 11%, secondary to complication where most of them were infection at the site, and other like they had their implanted IPG removed because of dissatisfaction of the outcome in a third of patients. In general, our experience is not that long, if we are talking about 4 years, but we are not far from other centers' experience who was were having longer follow-up more than our center. But in general, the outcome and continuity of the treatment was almost comparable, since if we are talking about like 50% of our patients still having their treatment in our cohort. And yeah, there are some patients who lost their effectiveness or like their efficacy, and that unfortunately lead to explantation of the IPG. Most of our cases were, as mentioned, urine retention, and this is comparable to other colleague studies. There is no doubt that sacral neuromodulation is promising modality. It approved itself over the last 2 to 3 decades, and the most important point in keeping effectiveness of this treatment, as well as accepting this treatment, is high selection of these patients, as well as increased awareness of this treatment among all physicians, starting from primary care, ending at urology specialty, because still we notice that there are some colleagues, they are not in favor of referring those patients for this treatment. And that's the end of my talk. Thank you.